All our lives we've worked hard. We've sacrificed to provide a good life for ourselves and for our family. We've looked forward to our golden years, looked forward to the time when we can retire, enjoy the fruits of our labors, spend quality time with our children, our grandchildren, and live the life we've always dreamed of. But what if that dream begins to fade?
Merong mga black spots sometimes when I look at things, an object. Minsan naman, hindi spots, but malabo yung portion. So, I knew something was not working right with my eye.
What if all the smiling faces and all the vibrant colors of life begin to disappear right before our eyes?
May naghinanakit na nga sa akin Tango raw siya ng tango sa akin. Hindi ko raw siya binabate. Sa totoo, hindi ko nare-recognize yung mukha niya
What if, in our golden years, we became blind? It's called AMD, or age-related macular degeneration. And in many countries, it's the leading cause of blindness in people aged 60 and over.
The eye is basically like a camera. You have your front part, which is the lens, and the back part, which is the retina. So the retina is like the film in the camera. Age-related macular degeneration is a disease of the retina.
As the term implies, it's age-related, and it has something to do with the degeneration of the most important part of the retina, which is the macula.
AMD is a disease that causes the loss of our central vision. It takes away our ability to see what we are trying to look at, whether it's our watch, the newspaper, or our own face.
The problem with macular degeneration is that a lot of patients notice the complaints when it's already very late in the process, because the symptoms come in very gradually. They're very insidious, and they are very mild at the beginning. It's very rare that you will get sudden blurring of vision.
Because AMD develops gradually, it's not always easy to detect the symptoms. But there are a few symptoms and warning signs that one should look out for with regards to AMD. The need for increasingly bright illumination when reading or doing close work, increasing difficulty adapting to low levels of illumination, such as when entering a dimly lit restaurant, increasing blurriness of printed words, a decrease in the intensity or brightness of colors, difficulty recognizing faces, gradual increase in the haziness of your overall vision, visual distortions such as straight lines appearing wavy or crooked, a decrease in or loss of central vision, and a central blurry spot. In addition, while the exact causes of AMD have yet to be determined, doctors have identified several risk factors which may contribute to the development of AMD. These factors include age, family history of macular degeneration, cigarette smoking, obesity, low levels of nutrients, and cardiovascular diseases. The symptoms of AMD can be very subtle, so if you or anyone you know have any of the symptoms, or if the risk factors apply to you or any member of your family, see an eye doctor immediately. Loss of vision severely alters the quality of life not only of the person affected by AMD, but also of his or her family.
Kami na lang dalawa kasi in the house and parang naiisip ko paano na pag wala na siyang eyesight, no? Sino na ang, wala na kaming means, wala na kaming mga anak namin, wala na. So parang ang ano ko is, you really need to go to the doctor right away when there is something not natural.
Upon visiting the eye doctor, he or she will conduct tests to determine whether you have AMD. You may also be asked to view an Amsler grid. A person with healthy central vision will see straight lines. To a person with AMD, however, the grid will appear distorted.
From there, if we suspect that they have age-related macular degeneration, we actually ask them to go through other diagnostic procedures. One is fluorescein angiography, where we inject a dye in the arm of the patient, and then we take serial photographs of the retinal area, or more specifically the macular area. And then the other one is the OCT. It's actually like an ocular ultrasound, and then we see if there is an area of elevated macula, or macula which is a little bit swollen.
If your doctor determines that you have AMD, don't lose hope. A few years ago, AMD was an untreatable disease, and people diagnosed with it had to live with the fact that they were going to become blind. But today, many advances in technology have made it possible for the progression of AMD to be delayed or even stopped.
To a certain extent, it's very difficult to treat, but because of the advances in science and technology and research, a lot of the treatment options are now available to us.
There's a recent study, the age-related eye disease study, which has shown that a certain combination of vitamins is beneficial or can prevent progression of the disease.
Aside from the special formulation of vitamins and minerals, there are 3 other treatments for patients with AMD. One is called photocoagulation, which uses lasers.
It's a thermal laser that burns the abnormality, but you can do this only if the problem is outside the fovea. The fovea is the center of the retina. If it's within the fovea, very near or on the fovea or under the fovea, then you have other options.
The other is photodynamic therapy, which utilizes a combination of lasers and drugs.
Okay, this is actually laser treatment wherein we also inject the dye, similar as fluorescein angiography, but we use a laser to activate the dye to actually quiet down the areas which are bleeding or leaking.
And the latest treatment is the injection of newly developed drugs directly into the eye.
So we inject the medication inside the eye to hopefully quiet down the areas also which are bleeding.
Best case scenario, there is some improvement in the vision. Worst case, you can still get worse, especially in cases where we catch it very late. The most important thing that you can do is to see your doctor early on, because the earlier we catch it, the better your chances are.
It cannot be stated strongly enough that the symptoms of AMD are very subtle. So if you or anyone you know have the symptoms for AMD, or if the following risk factors apply to you or anyone you know, go to a doctor immediately. Doing so can not only help you save your vision, but it can also preserve the quality of life of you and your family.
I think that the best thing that the patient or anyone can do is to have regular eye checkups. At the very minimum, every year go to your eye doctor. Like every other medical condition, prevention and early detection is always better than cure. It's always cheaper in the long run. It's less invasive, less painful. And if you catch it early on during your regular eye checkup, your doctor sees that there's something happening in your eye, then they can treat it earlier and you will have better results.
And when choosing a doctor, make sure he or she has the proper credentials, and make sure that he or she works in a hospital with the best facilities, with access to the latest and best treatments, preferably one that is accredited by the JCI or Joint Commission International.
All this means is that we follow a set of standards that ensure continuous improvement in the quality of care and, more importantly, enhance patient safety.
AMD in whatever form is something we all need to take seriously, because what is at stake is not only our eyesight, but the quality of our lives, of our children's lives, of our grandchildren's lives.
So I think that we should try to preserve our health and try to enjoy life. Kasi kung pababayaan mo, buhay ka, hindi ka mag-enjoy sa buhay.
Don't think of the expenses, no? Ang expenses you can earn, but your eyesight, wala na eh.
Kaya i-advise ko lang, kung may nararamdaman kayo, patinginan nyo na, agapan nyo na kaagad. Kasi mahirap yung nahuhuli.
Every day, more and more doctors are taking advantage of the latest technologies and the newest treatments to make sure that we never need to lose sight of what is central to our lives.